mama, she was a vile
Welcome back to the Now Morning Show. Our conversation shifts now. We're speaking to Dr. Mann. Dr. Mann is a doctor of pediatric medicine and a diplomate of the American Board of Pediatric Surgery. Retired, and he is the Chief Scientific Officer at Realm Labs and the medical advisor to All Care Home Services Limited. Dr. Mann will discuss with us LEAP, that's Lower Extremity Amputation Prevention, diabetic foot and leg amputations due to peripheral neuropathy. Good morning, Dr. Mann, and welcome to the show.
Thank you very much for having me. Good morning to you as well. Good to be here.
It's a pleasure to have you with us. Thank you for joining us this morning. Let's get straight into the conversation. What exactly is LEA?
Well, that's an acronym for Lower Extremity Amputations. Lower extremity amputations are when you have an amputation of a part of the lower extremity being anything below the hip. So that's the thigh and the leg and the foot. And lower extremity amputations are a significant problem throughout the whole of the Caribbean, including Trinidad and Tobago. It's primarily a problem associated with diabetes. Diabetics account for 90% of the people who undergo lower extremity amputations. There are different ways of classifying them. A lower extremity amputation that's of part of the foot, like the toe or part of the foot, or many toes, that's called a minor lower extremity amputation, although if it happens to you, it doesn't seem very minor, but nonetheless, that's the medical terminology. A major lower extremity amputation is one that occurs above the ankle. So generally it's above the knee, below the knee, where the amputation occurs, or above the knee, which is the most dramatic and drastic of the lower extremity amputations. Lower extremity amputations are, as I said, 90% of them are performed on diabetics. And they're often done as a result of infection or sepsis, which is uncontrolled because of the problem with diabetics and their feet and legs having impaired circulation and impaired nervous system function and impaired ability to heal from wounds and infections. And it's often done as a life-saving procedure, especially when it's a major amputation.
Dr. Mann, you've said so many things that we can delve into, but one of the things that I would love for us to just get into further is peripheral neuropathy and how it relates specifically to amputations. Because as you would have mentioned, perhaps if somebody gets a cut under their foot and it travels up, then we see something like this have to happen if it's been untreated. But specifically, what is that relationship with peripheral neuropathy and amputations?
Well, excuse me, you pronounced it beautifully. I say peripheral neuropathy, which is not as elegant as what you said, so please forgive my less elegant use of the language, Natasha. So peripheral neuropathy is, the nervous system is divided into two sections, the central nervous system, which is the brain and spinal cord, and the peripheral nervous system, which is all the other nerves. The nerves going into the feet and legs are part of the peripheral nervous system. And when there's a problem with the nerves going into the feet and legs, it's called the peripheral neuropathy. Peripheral neuropathy is very common in diabetes. It's the first complicating symptom generally in diabetes, and it's the most common complicating problem in diabetes. 50% of diabetics, if they live long enough during the course of their disease, will develop a peripheral neuropathy. Now, the hallmarks of a peripheral neuropathy are burning, tingling, numbness, shooting pains, disquieting feeling in the feet and legs, the numbness and the other symptoms that we express generally. It's in a very specific pattern. It's bilateral, which means it initially affects and finally affects both legs, both feet, at very similar and symmetrical manner, starting in the big toes and ascending up the foot and leg in the same sort of pattern that you would put your sock on. It starts on the toes and goes to the midfoot, then around the heel, and then up into the ankle. So it's described as a stocking glove distribution, glove being that sometimes it occurs in the fingers as well, and that it sends up the fingers in the same manner as up the foot. It has to do with the length of the nerve. The reason it occurs that way is the longer the nerve, the more likely it is to dysfunction or have a problem. And people with peripheral neuropathies in the lower extremities or the feet and legs generally feel the symptoms of numbness most of the time, but it can be very, very painful, and it can really change the quality of your life dramatically. It can cause your muscles to become weakened, and your gait or your ability to walk becomes much more unstable, which leads you to the possibility of falls. And all that's a whole other topic, but it certainly is something that affects diabetics. And it's unfortunate in that you need your nervous system, you need the nerves in your feet to tell your brain what's going on with your feet. Nerves are very, very protective. They tell your brain if you are wearing a shoe that doesn't fit properly, or if you just stepped on a nail, or you just stepped on something sharp. And you go ahead and you do the things you need to do to protect your foot if your nervous system is working properly. In diabetes, when your nervous system is not working properly and you have something called peripheral neuropathy, your brain doesn't know that something happened to you. For example, if you walk around barefooted, you could step on a stone or a piece of glass or something sharp. It could puncture your skin, and you wouldn't know that it happened. And that's very dangerous because, one, you'd be walking on that wound and not know that it existed until you saw evidence of it, like socks were bloody or there was pus or your foot got red, and it started an infection that ascended up the foot and leg. And you lose that protective sensation. It's called loss of protective sensation, and that is very, very dangerous. And that's the most common cause of diabetic amputations in the lower extremity. People lose their protective sensation, and just like the term protective sensation applies, you do not have the ability to protect your feet as you should if you had normally function nerves. And in diabetics, that's compounded with poor circulation and poor healing ability. So the goal, if you're a diabetic and you want to prevent this, is to do those things that prevent you from having a problem, those things that would minimize the chance of your having a break in the skin or having an ulceration or something puncture your skin. And you want to avoid that because when you do have a break in the skin, often what happens if it's unnoticed is it becomes infected. The infection goes into the foot and then up into the leg, and that's the general cause of lower extremity amputations. So the idea is to, one, do whatever you can to improve your circulation, do whatever you can to improve the functioning of the nerves in your feet and legs.
Right.
You want to keep your blood sugars under control. Mm-hmm. And there's a whole host of things I'd like to speak to you about when you have time, or when we have time during the interview, about things that you should specifically do to protect yourself.
Now, as you mentioned there, of course, there are some other things that we can do to protect ourselves. And thank you so much for sharing those tips you would have seen there on the screen. Let's speak a little bit about pre and post amputation treatment. What treatment is available, Dr. Mann?
Well, it depends on the level of health care that you're able to afford, etc. In general, when you have, let's talk about lower extremity amputations of the foot, etc. If you have an amputation of the toe or part of the toe, you go ahead and you, first off, keep your blood sugar under control and don't offend the area anymore. Keep it dressed. Generally, if you have enough circulation, then you can confine the area of infection and amputation to the part of the foot If that ascends up higher, many times surgeons have to take more of the lower extremity amputated in order to save your life. And you want to make sure that you moisturize the area of the stump of the amputation. You want to make sure that it's in contact with only smooth and soft surfaces. You want to make sure that you inspect it on a daily basis, as you should inspect your feet on a daily basis to see if there's any problems with the area healing. You want to make certain that you see a doctor on a regular basis. The surgeon who did the amputation, I'm sure, will be very interested in having you follow it up to make sure that the amputation site doesn't break down at all. You often are put into a prosthesis or an artificial leg, which you can go ahead and walk around with. And you want to make sure that the socket that the amputation stump goes into fits you properly. There's no irritation. You have to be the person involved with fitting you for the prosthesis wants to make sure that there's no edema there. That means swelling in the area so that the stump fits the prosthesis very well and the swelling does not become a problem.
Dr. Mann, we are almost out of time, but one of the things that you did mention earlier we need to go back to is the fact that lower extremity amputation, it has a high rate in the Caribbean. If there was one thing that you could recommend to those who could be subjected to that, what would you recommend that we do as a preventative measure?
If you're a diabetic or you're at risk because you have peripheral neuropathy, it's very important for you to, one, keep all of your medicines and your blood pressure medicines, your diabetic medicines. Follow your doctor's direction exquisitely. Make sure you're keeping all these problems under control. You want to make sure that you inspect your feet on a daily basis. And if you can't see your feet, get someone to look at them or look at it in a mirror. It's very important that if you have a wound or a problem that you address it immediately, as soon as possible. The longer you wait, the less likely, the more difficult it will be for it to be able to be healed. So you want to make sure you see the problem as quickly as possible. You know, as I said, you want to keep your blood sugar in check, your blood pressure in check. You want to make sure that you avoid tobacco in all forms. Secondary smoke, chewing tobacco, cigars, cigarettes, etc. Alcohol is toxic to the nerves. You want to make sure you don't have any alcohol or minimize it. Avoid sugary drinks and those things that you shouldn't do generally as a diabetic. You want to consult a diabetic educator. You want to make sure your socks don't have any seams that would hurt you, or the shoes that you're going to put your feet into are intact. The inside has to be intact. You want to wear good shoes. You want to make sure there's no pebbles or foreign bodies or pieces of glass inside the shoes. And you don't want to cut your own toenails or calluses. If you can't feel your feet, then you can cut yourself and take a piece of your flesh when you use the nail nipper. So make sure you have a professional do it, or a loved one, or someone who has expertise in that. And those are the primary things you want to consider doing. We have a nutrient that we have available on the island called Remedy, which helps to the nerves function more successfully in the lower extremities. You might consider doing that as well.
Well, Dr. Mann, thank you for sharing your expertise with us this morning and some important tips as well. Hoping that you have an excellent day, and I'm sure we'll be talking again at some point in the future.
I look forward to it, Ms. Lake. Thank you so much for inviting me. You have a wonderful day, and I wish all of your viewers a wonderful day as well. Bye-bye.
Goodbye. Thank you so much. Dr. Richard Mann, CEO and founder of Realm Labs, talking to us this morning about lower extremity amputation prevention and more. Stay tuned. The Now Morning Show is coming up after this break.